To this channel, and today I will discuss about the blood substitutes and exchange transfusion. So substances that are infused in the body instead of whole blood, substances infused in body instead of whole blood is called as blood substitutes. Commonly used ones are, for example, number 1, human plasma, number 2, 0.9% sodium chloride solution, which is also known as normal saline, and 5% glucose. Next is colloids like gum acacia, albumin, and animal gelatin. Now these are all about blood substitutes. Now what is exchange transfusion? Exchange transfusion. So exchange transfusion is basically the procedure which involves removal of patient's blood and replacement with removal of patient's blood and replacement with fresh donor blood or plasma. So basically exchange transfusion involves removal of patient's blood and replacement with fresh donor blood or plasma. So it is basically known as also replacement transfusion. It is an important life-saving procedure carried out for conditions such as severe jaundice, sickle cell anemia, etc. So the procedure involves both removal and replacement of affected blood in certain stages, and it is carried out basically in short cycles. First of all, the affected person's blood is drawn out in small quantities, for example 5 to 20 ml, depending upon the age and size of the person and severity of his condition. Now equal quantity of fresh blood, which is pre-warmed, or plasma, is infused through intravenous catheter. It is carried out for few minutes, and next the catheter is left in place and the transfusion is repeated within few hours. So this procedure is continued till or the whole or predetermined volume of blood is exchanged. Now there are certain conditions where we need exchange transfusion. For example, number 1, hemolytic disease of newborn, erythroblastosis fetalis. Erythroblastosis fetalis is a hemolytic disease of newborn. Number 2, severe sickle cell anemia. Number 3, polycythemia. Polycythemia means increase in red blood cell count. In case of severe polycythemia, replacement occur with saline, plasma or albumin, because red blood cell concentration is more, so in that case plasma is mostly useful. Now, number 4, toxicity of certain drugs. Toxicity by certain drugs. And number 5, severe jaundice in newborn babies which does not respond to UV. Normally neonatal jaundice is treated by exposure to the ultraviolet light or UV light, so it breaks down the bilirubin which is excreted by the liver. So this is about blood substitutes and exchange transfusion, and here I am ending my today's video. And if you guys like my videos, please subscribe the channel. Thanks for watching.